We are just days away from the MedTech World Bay Area, California 2025, and trust us, the energy is building. We spoke with some of the startups part of the MedTech Innovator cohort 2025, and they told us a bit of what is the expectation and why investors should keep an eye on them.
Yeah, this is a super exciting partnership because MedTech World brings together the best of the best from across the industry in different locations all around the globe. And MedTech Innovator, we're really more focused on the startups. And so to be able to give these startups the exposure on Friday to investors that are coming in from all over just to see them through the MedTech World event is really impactful. And I've really, respected MedTech World as an organization for many years now. And so really excited to see this relationship grow and our companies benefit as well from it.
Kelvin Health is basically advancing the standard of vascular care. We have a very non-invasive, precise method to diagnose peripheral arterial disease and eventually coronary disease. So with that said, investors who want to change the standard of care are the right fit for us. Basically, we aim to be in the guidelines for vascular diagnostics across US and Europe.
Thanks to our revenue and traction with users, we truly do have the largest vaginal dataset that is clinically validated, and we are currently looking for different applications of our vaginal data. Some of them we are already striking licensing deals with interested innovators in the space. So I think we possess a very important part for women's health and healthcare because vaginal data are very difficult to get. And once you have a product that tens of thousands of women use daily, and you can clinically validate the data that you're collecting, you can understand things that otherwise pharma companies or other companies investing in development for care or drugs in our space would not be able to get.
The investors really want three main things. They want that you have technology that is wanted by the payers and the users, the vascular surgeons in this case. You have a sound reimbursement strategy, and you have clarity in the regulatory pathway that you are going to have. And we check all these three boxes until Vask. So I think that the feedback we've got so far and the momentum we are getting around the MedTech world is going to make many investors to put their eye on us.
Connections, already making tons of connections right now, lots of smart people around, but also getting to have those connections with investors, getting to learn what they're interested in, as well as getting them to see what we do, help them understand why we're doing what we're doing, how it's going to make a big difference in women's health, in reconstructive surgery, in aesthetics, in that space. So having these connections and hopefully some funding at the end of it.